Hello, welcome to another episode of Arthritis and You, a Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Hey everyone, we're diving into a topic I know a lot of you are thinking about vaccines, especially when you're dealing with arthritis.
Yeah, it's a really common concern.
It's like, where do you even begin?
Right.
Luckily, you sent us some great material from Alberta Rheumatology, that YouTube video transcript. Ask the rheumatologist, can you safely get vaccines if you have arthritis? And their webpage on vaccine recommendations. They're really helpful for navigating this whole thing.
They are. And one of the first things they emphasize, which is so important, is that arthritis isn't just one thing.
Okay, so we're talking about the different types of arthritis and how that plays into vaccine decisions. I know our listeners are pretty savvy about this stuff, but a little refresher never hurts. What's the key distinction here?
You got your osteoarthritis, that wear and tear kind, which most of us will probably experience as we,
Get older.
Exactly. And honestly, it doesn't usually impact vaccine decisions too much.
Okay, good to know.
But then you've got inflammatory arthritis. Think the rheumatoid arthritis, psoriatic arthritis, lupus. These are autoimmune conditions. Your immune system is basically attacking your joints, causing all that inflammation.
And that's where things get a bit trickier with vaccines, right?
You got it. Because your immune system's already working overtime with inflammatory arthritis, staying up to date on vaccines is even more crucial.
It's like your body needs all the help it can get to fight off those infections, right?
Exactly.
So if you're dealing with inflammatory arthritis, what are the big things to keep in mind when it comes to vaccines?
Well, first things first, you got to know the difference between live and non-live vaccines. Live vaccines, like the MMR or the nasal spray flu vaccine, use a weakened version of the actual virus to trigger your immune response.
So it's like giving your immune system a little practice run.
Exactly.
Makes sense.
But for folks with inflammatory arthritis, especially if you're on medications like biologics, even that weakened virus can be risky.
So it's always best to check with your doctor before getting A and Y vaccine if you're on biologics, just to be on the safe side.
Absolutely. Always a good idea to have that conversation. Now, on the flip side, you've got your non-live vaccines. These are made with either killed viruses or just parts of them. So no risk of actually getting sick from the vaccine itself.
Got it. And these are generally considered safe for people with inflammatory arthritis.
Exactly. We're talking your flu shot, your pneumonia shot, the newer shingles vaccine, Shingrix.
So I'm hearing that not all vaccines are created equal.
Exactly.
And the plot thickens even more when you bring medications into the mix. Because I know from the sources you provided that certain medications can affect how well vaccines even work. What's the deal there?
You're right. So medications like traditional DMARDs, like methotrexate, and those biologics are amazing for calming down that overactive immune response in inflammatory arthritis.
Which is what you want.
Right. But sometimes
That's a double-edged sword.
sometimes it can mess with how well your body builds immunity from a vaccine. We're mainly talking about how effective the vaccine is, not whether it's safe to get.
Okay, so it's still safe, but it might not be as potent for someone on these medications.
You got it.
Okay, so for someone listening who IS on one of these medications, what does that mean for them practically?
Timing. Timing is key. Like someone taking methotrexate might be told by their doctor, hey, skip your dose after your flu shot.
Really?
And studies have shown that doing that can actually increase the antibody response by up to 20%.
Wow. Skipping a dose to boost effectiveness. That's pretty incredible.
Wow.
But I'm assuming those recommendations might vary depending on what medication you're on and which vaccine you're getting.
100%. And that's
talking to your doctor is so important.
Absolutely. Exactly. They can help you figure out the best timing and all that. Now, both of the sources you shared really get into the nitty-gritty of which vaccines are especially important for people with inflammatory arthritis. Do you want to dive into their recommendations?
Yeah, let's do it. Where do they even start?
Well, right off the bat, they highlight the flu shot.
Makes sense.
For good reason. We were talking about how inflammatory arthritis can make you more susceptible to infections, and that includes the flu. So that extra layer of protection is super important. And what's interesting is that the webpage specifically recommends either the higher dose flu vaccine, Fluzone High Dose, or the adjuvanted vaccine, Fluad, for anyone over 18 who's on DMARDs, and for all adults 65 and older.
Interesting.
So they're kind of giving your immune system a little boost, which can be really helpful if your immune response might not be as strong because of your medication.
Got it. So it's like a power-up for your immune system. What else is on the list?
Pneumonia is another biggie.
Right.
The sources mention that there are actually 2 different pneumonia vaccines, PCV13 and PPSV23.
Wait, 2? See, this is why I need you here.
Haha. I know, right? There's a lot to keep track of. And they protect against different strains of the bacteria, so it can get a little complicated. And actually, the webpage mentions that there's a newer one, Prevnar 20,
Okay.
that's recently replaced the older Prevnar 13 and Pneumovax 23 combo in many cases.
So there's a lot to keep up with.
There is, but don't worry, they actually have a really handy flowchart on the webpage to help you figure out which pneumonia vaccine you might need based on, like, your age and when you got your last one.
Oh, that's awesome. I love when they make it user-friendly.
Me too.
Yeah.
Makes things so much easier. Okay, moving on. Another important one they talk about is the shingles vaccine.
Oh, yeah. Shingles, isn't that the one that causes that really painful rash?
That's the one. And again, we've got 2 different vaccines here, Shingrix and Zostavax.
Okay, so what's the difference? Like, should I be asking for one over the other?
Good question. So remember how we were talking about live versus non-live vaccines?
Yeah.
Well, Zostavax is a live vaccine. So again, for some people with inflammatory arthritis, especially that's on biologics, it might not be the best choice. Shingrix, on the other hand, is a non-live vaccine.
Ah, got it. So that's probably the safer bet for most people with inflammatory arthritis then.
Exactly. And here's another thing. They recommend Shingrix for anyone over 50, even if you haven't had shingles before. They even mention that people younger than that who are about to start a specific type of medication, it's called a JAK inhibitor, sometimes used to treat inflammatory arthritis, should consider it too.
Huh. So many things to keep in mind. I'm definitely adding this to the list of things to chat with my doctor about. It's amazing how much the recommendations can change based on your specific situation.
Right. And speaking of things to discuss with your doctor, they also emphasize being up to date on those routine vaccinations you probably got way back when, MMR, chickenpox.
Oh, yeah, those ones.
Yeah, you might think, oh, I got those ages ago, I'm good. But the sources stress that it's really important to double check with your doctor, especially if you have inflammatory arthritis, just to make sure you're still protected.
Makes sense. Okay, so we've covered flu, pneumonia, shingles, those essential childhood vaccines. Anything else we need to have on our radar?
Yes. The webpage also has a whole section on vaccines for high-risk groups. This is where it gets even more personalized. They're basically saying, hey, beyond just having arthritis, there might be other things going on in your life that could influence which vaccines are recommended.
So it's really about looking at your individual risk factors.
Exactly. So, for example, they mention hepatitis A and B vaccines.
Okay.
These might be a good idea depending on, like, if you travel a lot, your job, even lifestyle choices. And they also talk about the HPV vaccine.
Right, the HPV vaccine.
That's usually given to younger people, but they say it might be recommended for adults too, depending on your individual risk factors.
This is really driving home why that conversation with your doctor is so important. They can connect all the dots between your health history and these recommendations.
I completely agree. It's like you're putting together this personalized health puzzle, and your doctor's right there with you, helping you find the right pieces.
Exactly. And speaking of that kind of teamwork, these sources are really big on shared decision-making. They actually talk about it specifically with the flu shot and methotrexate,
Oh.
where skipping a dose after vaccination could be helpful for some people,
Yeah.
but they're very clear that it's not like a blanket recommendation. It's about having that conversation with your doctor,
Yeah.
weighing those potential benefits and risks together.
I love that they emphasize that because it really highlights that you're not just a passive bystander in your own health journey.
Right. You have a voice, you have choices, and your doctor is there to help guide you and make sure you're making the best ones for you. So as we're wrapping things up here, should we do a little recap of the key takeaways for our listeners?
Yes, let's do it. We covered a lot.
So much.
So first and foremost, managing arthritis is not a one-size-fits-all approach, especially when it comes to vaccines.
Definitely not. And within that, knowing whether you have osteoarthritis versus inflammatory arthritis makes a big difference.
Huge.
Because if you have inflammatory arthritis, then you have to think about that difference between live and non-live vaccines, which, for some people, live vaccines might be off the table.
Right, especially if you're on those medications like biologics.
Exactly.
Yeah.
And then there's that whole thing about medication timing.
Oh, yeah, like with the methotrexate.
Yeah. Like, should you skip a dose after a vaccine or not? It's these little nuances that can have a big impact, and that's where having a rheumatologist on your team is so, so crucial.
They're like your vaccine strategists.
They really are. So I guess if there's one thing our listeners take away from this deep dive, It's don't be afraid to ask questions and advocate for yourself. Schedule that appointment, bring a list of questions, and work with your doctor to figure out the best vaccine game plan for you.
Couldn't have said it better myself. You've got to be proactive about your health.
Absolutely. And on that note, we'll let you go. Thanks for joining us for this deep dive, everyone. Until next time, stay curious.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com. Your trusted, evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upas, technical producer, John Iphone, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive!